I just came back from the White House Healthcare Summit, and it started 10 o'clock this morning. It's about 5 p.m., and we just got done, and I just got back into my office on Capitol Hill. It was an interesting day, to say the least, but the premise of the conversation that the president was initiating was, what's it going to take for Republicans to vote for my bill? And I spoke to him directly about that, and I'm somewhat disappointed that that's how he approached it. I hearkened him back to days when he and I were together in the Illinois Senate, and we worked on some pretty controversial things together. We worked together to change the Illinois death penalty procedures, and as I told the senators and other members of Congress, that was not a junior varsity effort. In other words, that's dealing with issues of vicious crimes and claims of innocence and a whole host of other things. But the point was, we were able to come together and negotiate basically on a clean piece of paper, and he didn't approach that by saying, what's it going to take for you to vote for my bill? Flash forward, here we are dealing with a much bigger issue, admittedly, but I think the danger, or the weakness of how the White House is approaching this is they somehow feel as if they just have one more conversation about this bill, then the American public is going to have this aha moment and go, oh, I didn't realize that. That's fantastic. But what they don't realize is that the American public started listening very, very early, and in fact they were hopeful when President Obama started talking about health care reform. And as I told the president, that wasn't a bumper sticker. People were really hopeful when he started out on this thing. And they listened to all his speeches and all his interviews and his joint session speech and his town halls and his rally and even his Super Bowl prelude. But they've come to the conclusion that they've heard it, they understood it, he's communicated it clearly, and they've said no. They want no part of this thing. And I think what we need to be doing is concentrating on incremental changes. In other words, doing the types of things that bring healthcare costs down, like dealing with the medical liability system, like dealing with the ability to purchase health insurance across state lines, or for small businesses to pool together. So, look, we're not out of the woods on this adventure, and this is Nancy Pelosi and Harry Reid are determined to turn the high beams on and jam this thing through. I'm convinced of that. But we need to be very vigilant on this and make sure that we don't allow 1/6 of our economy to be taken over by the far left in our country.